Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good evening, everybody. My name is Dr. Marianne Puvatingal. I'm actually a consultant neurologist at Amala Hospital in Thrissur, Kerala. So I would like to be sharing my ideas about epilepsy with you all today.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay. So seizure is a very common thing that all of you will be seeing on a day-to-day basis. So basically, what happens is our brain basically controls the entire body. So it's like a set of electric wires which is controlling the various functions of the body. So what happens is when there is some electrical malfunction within the brain, that can produce a seizure. So that can manifest in several different ways, depending on which part of the brain is actually involved. So it may be sometimes like what we see when there is excessive movements of the limbs, or it may be coming with other rarer symptoms which we'll be seeing later on.
What is epilepsy?
Okay, epilepsy. So this is another term which we'll be often be hearing in people with seizures. So some people, what happens is if there is only one seizure, they may not have a seizure again. So when will you call it epilepsy, or in the local language if we say avasmaram, basically the seizures they should have been occurred at least two over a period of 24 hours, or they should have a chance of recurrence of the seizure which is above almost 60%. So only if the person fits into this criteria, then we can call it as epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Okay, so in epilepsy, as there are so many different types of seizures, and the causes can vary. So if you see the entire population, so about maybe 10 million people almost suffer with epilepsy, and actually the causes again vary. So if you see this entire population, almost maybe only 50% persons will have actually a cause or a reason for the epilepsy. So it can be due to different kinds. So what we see in a normal day-to-day basis, people who have a low electrolyte level, like a low sodium or very high sugars, or sometimes a brain tumor or stroke. So whatever causes damage within the brain can lead to a seizure. And the other group comes under the genetic epilepsies. So they may have some genetic defect, or they may be included in some epilepsy syndrome. So all these can actually cause
Okay.
seizures. So actually, but the total number, if you see, only about 50 to 60% will have a diagnosed cause for the seizure.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. So as I told you earlier, actually the seizure is actually occurring due to the malfunction of the brain. So depending on which part of the brain is actually involved, the symptoms are going to vary. So if you consider the motor area of the brain, so that is a part of the brain which is going to generate movement. So in that particular group of patients, so this is the type of seizure which we commonly see in TV or which we encounter, which is called the generalized tonic-clonic seizure. So in these set of people, they'll have excessive movements of the limbs. So they'll have jerky movements of the hands as well as the legs, and later on they'll go into unconsciousness. So this is what we call generally as the generalized tonic-clonic seizures. Then the other group, they may have focal seizures. So again, depending on the part of the brain affected, it may be only one part of the body which is moving. So only one hand or one leg may shake. Then other than that, people can come with so many very different types of symptoms. So some people may just come with a feeling of fear, or they have a rising sensation within the abdomen, which is called an epigastric aura. At other times, they may present with chewing movements. They may have only movements of the mouth,
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Oh, okay. So actually, there is a big fear of epilepsy within our community. So earlier on, many people used to think it as a possession or a demonic problem which is going on, and actually, this myth is still going and is very strong in several parts of our society even today. So actually, there is nothing related to such issues, and it's all a particular part of the illness itself. So if you actually find out the illness and you're able to manage it properly, then actually they can have a very controlled lifestyle. So there is actually no need for stigma. It is not a genetic disease. It is not going to get transmitted to the next generation in most type of cases, and it is not going to be communicated to anyone else. So actually, there is no need for any fear to interact with this group of patients. And actually, they need our complete support to lead a normal life.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. So basic problem is, first of all, you have to identify the seizure. So if it's a person who's getting recurrent seizures, they'll know that sometimes they have something called an aura. So that will be a warning that the seizure is going to occur now. So in such cases, you have to take the adequate precautions. So always make sure that they are not near any dangerous surface. So basically, when they fall down or when they jerk, they can get hurt if it's in a problematic place, or if, for example, if they're cooking or something. So in such cases, and especially if the patient is alone, it is better to avoid working on the stove, etc., especially if the seizures are not controlled. Then if the person develops seizure, always make sure that they're in an open place and place them to the side, so that they don't aspirate their own secretion. So actually, a lot of people say you have to give them metal to hold in their hand. So that and all is not correct. There is no need for that. So if it's a normal seizure, if you just carry out this maneuver, it will stop within 5 minutes. If it's not stopping, then you have to make sure that the patient reaches the hospital immediately.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah. So as we said earlier, there is absolutely no stigma which should be attached to epilepsy, and nobody should worry that they have epilepsy. If you are meeting your doctor and you're getting consultations regularly and you're taking your medications on time, you can lead an absolutely normal life. You just be careful especially when there are dangerous situations. So be careful while driving or in other such situations. Otherwise, with the help of doctors and your family, you can lead a completely normal and fruitful life.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.